Welcome back to 12 Days in March. In this video, as the name implies, we'll focus on Step 1 preparation and the struggling learner. Although I focus on the struggling learner, this material applies to anyone who wants to improve their preparatory strategies and test scores. In this presentation, I will lay out some of the reasons that students struggle and outline what I consider to be some of the best practices in order for you to achieve success in your studies. If I had to summarize or characterize in one sentence the basis of poor test performance, it would be this: students fail to properly engage with content, with an emphasis on properly engage. The whole rest of this presentation focuses on the reasons and consequences of poor engagement and, more importantly, how to fix the problem. Built into this presentation is the need to dispel some of the myths and fake news students hear about how to prepare. Specifically, and too often, students are taking the advice of high test performers. Whereas those recommendations and techniques work well for them, they don't work for the rest of us. I don't mean this as an insult to those with strong test scores, but for those of us who reside on this portion of the bell curve, we need a different set of preparatory strategies. With that said, I want to emphasize this right from the onset, and I'll say it repeatedly. For those of you struggling to gain traction with your studies, there is nothing wrong with you. The problem resides in preparatory process and techniques. These are totally fixable. And as I hear from students who struggle, no one tells them how to prepare. Consequently, they repeatedly try unsuccessful methods and of course become frustrated with the lack of improvement in spite of hours of studying. All I can say is technique matters and there is a method to the madness. Moving forward, I know that everyone wants short videos and quick fixes. Generally speaking, I do try to keep them short, but this presentation is full court press, no holds barred. For my recommendations to make sense, you will need a very brief understanding of learning theory and how learning is achieved. It will be a short digression, but I'll be constantly referencing this material throughout the rest of the presentation. So put your seatbelts on and pay close attention. So let's start here with a very simple concept. What is learning? Learning is said to have taken place when individuals acquire a change in their capabilities, and that change might be in knowledge, skills, attitudes, or behaviors. So when we say change, what has changed? It is literally a biologic change in neuronal connections. Learning involves a change in the strength and physical structure of neurons and their synaptic connections. The preparatory methods reviewed in this video will describe the best practices for forming and strengthening these connections. When all is said and done, I am actually going to change your brains. That's exciting. Alright, the first step in learning requires the precondition of engagement and motivation, or simply paying attention. Motivation is typically described as being internal or external. Internal motivation can be simply described as coming from the love of learning. External motivation, on the other hand, is learning something because you have to, as in preparing for Step 1. Suffice it to say, you are all externally motivated, but don't forget to love what you are learning. Once motivated, the next step involves the acquisition of information or new knowledge. Beyond acquisition, all information is then integrated with your prior knowledge or beliefs. This integration or modification of prior knowledge is going to get plenty of airtime later in this video. This process of acquisition and integration is often described as sense-making. You create mental representations of information that will subsequently be encoded for Step 3, storage and long-term memory. The goal of these mental representations is to make content sticky. It is worth mentioning with 80 billion neurons, literally everything we see and do leaves a trace in our memory. These memory traces are described as available, but just because they are available doesn't mean they are accessible. Which leads us to the fourth and most important component of learning, retrievability. Information in your long-term memory is of no value if it can't be accessed. Come test day, you need to be able to dredge up content for use in your working memory. Which brings us to questions as a learning tool. All questions and practice tests are best described as opportunities to practice retrieval. So goes your retrieval practice, so goes your test scores. On the subject of information retrieval, I find this description compelling. Retrieval is not like pulling a book from the library shelf. Each time we retrieve a memory, it is altered or reconstructed. The act of retrieval itself makes it much more likely to be retrieved again. Which brings me to this metaphor. In her book, How to Learn, Barbara Oakley refers to practice and memory retrieval as creating a trail through tall grass. Each time you walk through the grass, the trail becomes more and more well-formed. And so it goes with memories. Each time you recall a memory, the synaptic connections are strengthened or become better formed. So, in this introduction, I presented a brief overview of learning with an emphasis on the importance of retrieval and accessible information. Through the use of questions as a learning tool and the techniques presented in the remainder of this video, hopefully you'll come to appreciate why I describe these recommendations as best practices for forming and strengthening neuronal connections. All right, with that background, we are ready to launch. So, this Michael Jordan quote says it all. You can practice shooting 8 hours a day, but if your technique is wrong, then all you become is very good at shooting the wrong way. And so it goes with bad techniques. Students become very good at preparing the wrong way. So when I describe a failure to properly engage, I'm simply describing bad techniques. When I say it is not the student, it is the process, I am describing lousy methods. And I don't mean that as an insult. But here's the good news. The skill set to be successful is readily achievable. Said Glinda the Good Witch, Dorothy, you had the power all along. You have the power to be successful. So the rest of this presentation and recommendations derives from my one-on-one observations of medical students over the last 15 years. I've worked closely with countless struggling learners. The lessons learned are compiled in these remaining sections. I would encourage you to take breaks as necessary. The material is dense but relevant if you are not achieving success in your many hours of Step 1 preparation. So with that said, let's get this started. So, technique error number 1 is the failure to do questions. This seems rudimentary, but there is more to it when we scratch beneath the surface. One of the first questions I ask students is whether they've done Qbank questions and specifically how many they've done. Every student says they've done lots of questions. But when I ask them to send me a screenshot of their question usage, this is what I get: low utilization. It's not that the students are lying to me or to themselves. They do lots of questions, but it is only a small percentage of the available questions. So when students tell me they've done 250 questions, I don't really need to explore further. The lesion is obvious. They simply haven't done enough questions. And let's stick with this imagery. With so few questions, the memory trails are poorly formed. Their synapses and neural connections are weak, and their learning is quite superficial. We're going to move on to technique in a moment, but I want you to ponder this student. She did lots of questions in practice tests, but her scores weren't improving. This is to underscore and create some background that questions are important, but technique matters. We'll return to this conundrum later. So here's the next major issue. Students use Qbanks for testing, but Qbanks are for learning, not testing. Do you understand that? If you using the Qbank to test your knowledge, you are throwing away your time and money. The purpose of the Qbank is to learn and cement knowledge. Embrace this concept, questions as learning and their role in knowledge construction. So let's think about your current approach to learning content. The initial stage is the passive reading or viewing of content from any source. From there, you might do some questions. But then you discover the questions aren't working out too well. So what is your instinct? You go back to studying and rereading your notes. But the thing is, reading your notes didn't work the first pass through. Returning to that approach isn't apt to be successful the second or third pass through, not for the struggling learner. The synapses are few and the connections are weak. The approach of rereading notes is exactly what I mean in describing the failure to properly engage with content. So what's the problem with this approach? Well, here comes the phrase from the education literature, the illusion of competence. It is exactly as it sounds, the illusion of retaining content through the process of passive, disengaged studying. The illusion of competence describes the superficial familiarity or marginal knowledge that comes from passive reading. You might recognize this in your own study approaches, and specifically when you are trying to solve problems. Statements reflective of marginal knowledge include, "The answer was at the tip of my tongue," or "I thought I had a good grasp of the material." When you say "I thought I had a good grasp," it means you've been exposed to the material but haven't achieved mastery. Simply described, your memory trail is not well formed. The knowledge resides on the margins. And why is that? Well, when we read, content and thoughts enter our working memory. Working memory, by definition, is of limited capacity and short duration. So with reading alone, without retrieval practice, you shouldn't be surprised by this superficial familiarity. Now, even if your reading was successful and you were able to memorize everything, Step 1 and other tests generally assesses not just what you can remember, but whether you were able to apply the knowledge and principles. And this passage pretty much summarizes the conundrum. Exams are not a test of how well you can memorize, but how well you can use what you remember. Reading alone won't get you there. Learning has to be effortful and engaged. It actually has to hurt your brain a little, but questions as a learning tool will get you there. So what do top test takers do differently? On average, they do more questions and practice tests. That said, the skill to be a good test taker is readily achievable. So we need to do questions, and we understand, based on learning theory, why they are necessary toward the construction of knowledge. But how we do them matters. Let me reiterate. If you've been struggling or simply want to do better, it's not about you. It is your technique and/or methods. In the remainder of this video, we'll focus on the tools you need to achieve success. And if I may, for any student who is struggling to achieve success, I offer this quote. Your present circumstances do not determine where you can go, they merely determine where you start. You got this, you can do it. So here we go. Technique error number 3 are question blocks. Obviously, when you construct practice tests, you select blocks of questions of varying length. But that's not the problem. It doesn't matter how many questions you choose to do. What matters is how you review those questions, and this is a very key point. Review the answer explanations one question at a time. You got that? One at a time. To accomplish this, you will set your questions for untimed tutor mode. To be clear, it doesn't matter how many questions are in your block, but you must stop after each question and review the correct response. And here is the lesion for students who struggle. They do all 40 questions at once, and then they sit down to review the answers consecutively with an emphasis on consecutively. This approach is ineffective and defeats the whole purpose of doing questions. It represents a major missed opportunity for learning and positive reinforcement. By way of example, if you're doing pulmonary questions and the first question is on fungal infections, your learning about Cryptococcus in question 1 will help inform your problem solving when the next question is on histoplasmosis. You learned about Cryptococcus and will recognize why it can't be the answer to a histoplasmosis question. Remember, with each question you are forming and strengthening neural connections. By engaging with one question at a time, you are optimizing learning. If, on the other hand, you review 40 questions consecutively, your retention is poor. The information becomes a blur, and you lose out on the reinforcement that comes from question to question. Again, this is what I mean when I accuse students of not properly engaging with content. Buzzing through 40 questions is not the goal. You need to stop and engage after each question. In summary, do not review clusters of questions. This is a passive, disengaged learning experience. You might as well have just reread a textbook. You lose the opportunity to construct knowledge by missing out on the positive reinforcement that comes from question to question. The result is poor retention. Our motto, do a question, review a question. We're going to transition to the next error in technique. But as I make these recommendations, let me just acknowledge that students come in all sizes and shapes. Some are more expert than others. My recommendations apply to any student that wants to improve their scores, but they are more compelling for the novice learner. We'll return to this distinction later. All right, let's move on to the next set of errors, random questions. If our goal is to form and strengthen neural connections, how does randomness affect this process? So let's use this example from cardiac pathophysiology. Assume your first question focuses on the cardiac cycle and addresses the left atrial pressures in mitral stenosis. What happens if you see another cardiac cycle question a few questions later, focusing on the LA pressures in mitral regurgitation? This becomes positively reinforcing both about the cardiac cycle and mitral valve disorders. One question reinforces lessons from the other, effectively strengthening your synaptic connections. But what happens if, on the other hand, you review a cardiac pathophysiology question, followed by a brachial plexus question, followed by another on biostats? I'll tell you what happens. Bupkis! You have chaos, confusion, and zero retention. The information enters one side of your working memory and exits the other. With random questions, we give away the opportunity for positive reinforcement, trail building, and effective learning. When I talk about random questions, I'm really talking about random organ systems and subdivisions. To properly engage with content, I highly recommend that you do one organ system at a time. This is a time-tested strategy. Not only should you do questions by organ system, but the sequence within organ systems matter. By following the recommended sequence, you will maximize the construction and knowledge. So sticking with the cardiovascular system, for example, I encourage you to do physiology, followed by pathophysiology, followed by pathology, followed by pharmacology, with each subdivision reinforcing the previous. After all, what is pathophysiology other than applied physiology? What is pathology other than applied pathophysiology? Likewise with pharmacology, other than pharmacodynamics, isn't pharmacology just applied physiopathology? Each subdivision reinforces the lessons from that which preceded. And by the way, students always ask, can I do 10 physiology and then 10 pathophysiology questions? And the answer is an emphatic no. Do all of cardiac physiology before proceeding to pathophysiology. You need the full physiology background to optimize your learning. Doing incremental components defeats the purpose of the sequencing. Well, what do we have here? Could it be the question percentages from the USMLE? Look where the majority of your questions are coming from. Pathology, including pathophysiology, physiology, and pharmacology. Well, what a coincidence. If this is the bulk of the questions for Step 1, doesn't it make sense to get it right? Nailing these subjects will pay big dividends. I'm not going to harp on learning theory, but remember our introduction about learning? Each new fact has to integrate with prior knowledge. Working within organ systems and following a logical sequence will absolutely facilitate that integration. And again, when I talk about a failure to properly engage with content, this is what I'm talking about. Random organ systems with no particular sequence represents a lost opportunity to properly engage with content. So please do questions by organ system and follow the specified sequence. Remember, our goal is to put this guy out of business. To finish up with the Step 1 disciplines, I do encourage both microbiology and immunology questions to be done by organ systems, but you can do these whenever you want. There is no particular sequence, but do stay within organ systems as the questions are very reinforcing. Specifically, there is no reason to mix pulmonary organisms with GI organisms. That is just too random. Stay within the organ systems to maximize reinforcement and strengthening of synaptic connections. If you must do random questions, and I know you must because students are crazy, save them for these disciplines, which are anatomy, histology, and genetics for those of you listening on audio. The stakes are lower with these disciplines, and randomness is less impactful. Alright, I have a quick tangent before proceeding to the next set of topics. I feel obliged to mention a word about Anki Dex. I have no issue with the idea of Anki and spaced repetition. My problem with Anki, however, is twofold. First, it is a major risk factor for the struggling learner. Generally speaking, Anki Dex are a random collection of facts devoid of principles and applications. The novice student cannot achieve primary learning, right? That's the issue, primary learning from Anki. But they try. For expert students, Anki might work well, but if you are struggling to organize, understand, and retain content, steer clear of Anki. The second issue, and returning to the point I made earlier, has to do with advice. Expert learners succeed with Anki because they can. There are Anki disciples out there, but on average, it is not an effective learning tool for the novice student. Do not use Anki as a primary source of learning. Unfortunately, many students make this discovery when it is too late. If you have to use Anki Dex, limit their use to memorization topics such as biochem and anatomy, but do not use them as your primary source of learning. Well, enough of Anki. I know this is an ugly slide, but it is a summary of what we've covered so far. We have one more section to go, but first, let's come back to our student who did lots of practice questions, but her scores weren't improving. Based on what we've reviewed so far, what was the problem? And the answer is technique matters. She jumped right to the practice exams without ever going through the Qbank. She was testing before fully cementing content. She was struggling with marginal knowledge. She ultimately committed to the Qbank and did fine. And this brings me to the CBSSA exams. Unlike the Qbanks, the CBSSA exams are for testing, not for learning per se. These exams offer the opportunity to do blocks of random questions. Most students will do several of these exams, and you should as well. By virtue of their availability, it frees you up to use the Qbanks for studying and learning, not testing. The CBSSA exams should complement your practice questions and practice techniques. Taken as a whole, these are very powerful tools. Which brings us to the final leg of our tour. This material is as important as anything mentioned so far. If you are overwhelmed or burnt out, take a break. This presentation is not an assignment to rush through. It is designed to help you achieve success, so don't proceed until you are ready. Well, hello, you still there? Alrighty, as I mentioned, I've done countless one-on-one sessions with struggling students. From this work, I've constructed a set of golden rules. The golden rules focus on test-taking skills rather than the construction of knowledge. As you can see, these test-taking skills can improve your scores without adding a single additional fact. So let's take a peek. Golden rule number 1, questions have hierarchies. In the question stem, data is more important than physical exam, and these are more important than verbiage. We've certainly been practicing this throughout the academic year, and the golden rule is illustrated in most of the 12 Days videos. Within the hierarchy, you need to pay attention to both normal and abnormal information. Remember, the question writer has 4 sentences to convey a lot of information. If they tell you a patient has no S3, for example, they are telling you that congestive heart failure is not the diagnosis. So as you go through the Qbank, remember negative information matters. And here's a question I reconstructed. Don't be afraid to do this. You can see there was no data, but the physical exam describes unilateral hyperresonance with the loss of breath sounds. With this information, the question writer is telling you the patient has a pneumothorax. We'll come back to this question shortly, but first let's explore our next golden rule. Golden rule number 2 is hyperfocus, as in don't do it. Hyperfocus is just as it sounds. Students focus on one fact or piece of information while completely disregarding or ignoring other pertinent information. So in this example, we have a pregnant woman experiencing heat intolerance and palpitations. She is noted with an enlarged thyroid gland. This sounds for all the world like she might have Graves' disease, except the TSH is normal. This can't be Graves' disease. In Graves, we expect a suppressed TSH. So what do we have? The normal TSH tells us the patient is euthyroid and she is in her second trimester. This is a question about thyroid binding globulin and how it rises in pregnancy. The question highlights the cognitive error of confirmation bias. This bias describes a process of focusing on information that supports your diagnosis while ignoring disconfirming evidence. Students do this all the time. And here's a graphic sent to me by a student years ago. It pretty much tells the whole story. We have the typical presentation sitting right here in plain view, but the student who hyperfocuses obsesses on the useless clue. They ignore the pertinent information in favor of a useless piece of information. Moreover, it gets worse. Students start making up information to support their mythologic reasoning. Let me remind you, you aren't allowed to rewrite or make up your own questions. You have to work with the question writer. Become hyper-vigilant in catching yourself making up stories. Good test takers are capable of catching themselves making up nonsense. All right, the last golden rule I'll mention is the importance of typical associations and how this plays out when you catch yourself with that timeless line, I narrowed it down to 2 choices, but always picked the wrong one. So let's return to our patient with a sudden onset of chest pain and an abnormal physical exam. Students reliably identify this patient as having a pneumothorax. But here's the problem. Half the class calls it a tension pneumothorax, whereas the other half selects the ruptured bleb. How to choose in these uncertain instances? You go with the typical associations. If this were a tension pneumothorax, you would expect the stem to include information on shock, tracheal deviation, and/or a stab wound. None of these are mentioned. Given the absence of these typical associations, you cannot select tension pneumothorax. You are left with a ruptured bleb occurring in the setting of a spontaneous pneumothorax. Remember, your answers have to pass the sniff test, and if they aren't giving you the typical associations, it can't be the correct answer. These 3 simple rules will improve your test scores without a single stitch of additional knowledge. But you have to continually practice and refine these skills when going through questions. For some, these will make all the difference in achieving a passing grade. Now, I can go on all day with other test-taking skills. To be sure, no two students are alike. They all find nuanced ways of getting themselves into trouble, but if you properly engage with content, as described throughout this video, these smaller test-taking errors should become irrelevant. Alright, finally a couple of odds and ends, and we'll get this across the finish line. First, although we reviewed these graphics, let me clarify that Qbanks are not a substitute for the primacy of content. You need to give it the once-over, but once you've initially studied content, using questions as learning has other key advantages. Most importantly, they do allow you to identify knowledge gaps. How else would you know what you don't know? Secondly, they enhance your metacognitive sophistication. That's a fancy education term, but what does it mean? It simply implies that your studying becomes more effective, focused, and engaged. Your question errors and identified knowledge gaps make you a better student and learner. My final learning pearl addresses this refrain. My test scores are not improving. I'm going to reread Pathoma or Notes or other. I've already spoken about the illusion of competence, but I wanted to mention there is abundant evidence in the education literature, specifically in comparing the preparatory strategies of study, restudy, and that would be rereading your notes, for example, versus study and test, that would be doing questions. One strategy is far superior. And of course, this isn't going to be a surprise for you. The study-test strategy is a far more effective approach for retaining content over the longer haul necessary for exam preparation. This approach takes more effort and it is less comfortable than just reading, but it is a superior method for constructing knowledge. So bringing it home. In this presentation, we addressed how top students approach test preparation, and we described several techniques that will help you achieve success. I emphasized that the skill set is readily achievable, and I characterized in a sentence the primary issues with a struggling learner, that being a failure to properly engage with content. And I can't emphasize enough, there is nothing wrong with you, only your preparatory strategies. In this video, I offered you a toolkit and instruction manual. And of course you're asking, does this approach really work? I'm going to go with yes. Year after year, I get to experience the incredible joy as an educator when these screenshots start arriving in my inbox. I'll spare you all the testimonials, but let me conclude with this quote. Success is not final. Failure is not fatal. It is the courage to continue that counts. I have worked with many, many courageous students who started well behind the 8 ball and mustered unbelievable courage in overcoming their preparatory shortcomings. My goal with this presentation is to eliminate the barrage of emails that arrive in the weeks before Step 1. All my tips, recommendations, pointers, and advice are spelled out in this video. I have no doubt that some of these messages will resonate with you. I am confident you can identify and correct your preparatory challenges by following the advice contained in this presentation. And let there be no doubt, this educational effort is dedicated to every student that has taught me so much about the process and their struggles, and as they say, so that no student should have to go through this again. Well, I know you didn't enjoy this video, but I do hope you find the lessons and recommendations to be useful in remedying and or preventing any struggles in the weeks leading up to Step 1. If you have any questions or concerns, please reach out. Otherwise, best of luck in your Step 1 studies.